Endometriosis appears to be a much more common condition than I think many of us would have guessed or estimated, where some of the newer studies are suggesting that up to 50% of the population that is afflicted by infertility may have some level of endometriosis, which is obviously very concerning, especially considering that I would say a much smaller portion of patients that we see in practice have a workup or evaluation for endometriosis, even if they're seeing, in many cases, symptoms and signs suggesting that endometriosis is probably present. And some of the main symptom for endometriosis that we would see is a painful menstruation, so dysmenorrhea as it's referred to. And because that's such a non-specific symptom, a lot of patients are regrettably told that they could just use birth control, it's probably just normal, without necessarily discussing further investigation to see if this is something that's contributing to the pain and also affecting fertility. Now, when it comes to the treatment of infertility, the treatment of endometriosis more specifically, it really depends on the type of endometriosis the patient has. And in general, in research, we divide endometriosis into three categories. Endometriosis can be classified as being superficial peritoneal lesions. So the peritoneum is a serous layer of membrane that lines the abdominal cavity. It can be infiltrating deep lesions, which is often like a more severe scenario or form of endometriosis, which can often relate to or cause adhesion, scar tissue, changing in the position or anatomy of the fallopian tubes where they start to curve and bend, or develop what we call kissing ovaries, where they can actually start to form a different anatomical position than we should normally see in a healthy reproductive age patient. And the third and more specific type of endometriosis that we want to chat about today, because having this type of endometriosis seems to affect fertility quite significantly, is ovarian endometriosis. So it's where we actually see lesions of endometriosis on the ovaries. And this is quite unique because a lot of patients with ovarian endometriosis, or OE, may not have any particular symptoms. They may actually have totally pain-free cycles, no significant pain that would really point to endometriosis. So more often than not, when patients are diagnosed with ovarian endometriosis, even though it can present with pain, a number of patients are quite surprised because they would have never guessed or didn't really have any symptoms suggestive of that. Now, what occurs is with ovarian endometriosis, we see some very particular changes. One, the follicle count, when we're checking for egg reserve, seems to decline quite a bit. And we see that egg quality seems to decline quite a bit. So these two changes often lead to quite a difficult predicament when you're dealing with fertility treatments, because now not only do we have lower eggs to retrieve or lower eggs to work with, but the quality of those eggs is probably lower because of the endometriosis as well. And there have been some hypotheses as to why egg quality may decrease when we're dealing with endometriosis. And a very new research paper published this year that was received by the journal in 2022 in June. And we have the reference for this research paper on our blog post that you can check out on our website as well. Looked at a very particular phenomena that occurs with endometriosis in the ovary. And in particular, what we're seeing is almost like a toxic overload of iron. So that supplement or mineral that we often take during pregnancy, or have high iron diets if you're having a lot of red meat and animal products, the high iron levels with endometriosis seem to drive the decrease in egg quality. And we see that iron can go up in the follicular fluid of the ovary through two main mechanisms. One is the cyclical bleeding that occurs from these endometriosis lesions in the uterus or in the peritoneum. And then two, we see actually retrograde menstrual flow. So during menstruation, instead of just having a downward flow, sometimes menstruum can have what we call retrograde. So it goes back into the fallopian tubes. And the iron in this blood can lead to increased iron absorption in the follicular fluid of the ovary itself. And this increased iron that they observe in patients with ovarian endometriosis in the follicular fluid really seems to drive particular changes. So we see an increase in something called lipid peroxidation, and this drives increased oxidative stress, and this depletes the antioxidants such as glutathione in the cells. So we see a decrease in antioxidant status, increase in oxidative stress, and these very specific changes that revolve around high or toxic iron levels in the cell drive a very specific or particular type of programmed cell death called ferroptosis. So this is different from apoptosis. It's specifically driven by the high iron levels. And the high iron levels, because they're causing this programmed cell death in what we call the granulosa cells being one of the most abundant cells in the ovary, and they are have a very strong role in driving follicle growth and maturation, so damaging or reducing the quality and proper activity and functioning of the granulosa cells seems to negatively affect the signals it's supposed to give the follicles and the eggs to properly mature and grow. And so we see a disruption in the granulosa cells, and that disruption in the granulosa cells seems to affect the egg quality as well. So this is a more novel mechanism that we're seeing in the research that isn't very commonly discussed as to how ovarian endometriosis is actually causing the decrease in egg quality. And this is very important because once we have a better understanding of why these changes occur, then we can start to address how can we prevent this, or how can we reduce the negative effect of iron overload in the follicular fluid. So these researchers used two particular compounds, and they found that just using an antioxidant called vitamin E or tocopherols combined with an iron chelator. So iron chelators are compounds that help to reduce the amount of iron in the body, or they help to excrete excess toxic levels of iron. The combination of these two compounds together in patients with ovarian endometriosis seem to help normalize a lot of the negative effects or changes we would initially see. And so we're basically seeing a new avenue opening up on how to help support patients with ovarian endometriosis, how to reduce the negative impact of endometriosis-related iron toxicity in the ovary, and how to reduce its negative impact on actually supporting fertility and actually trying to improve chances of conception with higher quality and morphologically normal follicles.